Welcome to Tuesday's edition of COVID-19. Korea has recorded more than 1,000 infections today, and efforts to contain this latest outbreak are taking place alongside those aimed at securing vaccines for the public. Speaking of vaccines, that is a topic we plan on touching upon in today's studio session. I have Kwon-Soo standing by now with the broader pandemic coverage. So I hear we have over 1,000 new cases here in Korea on this Tuesday.
Yes, we do, Sunny. Following 3 straight days of a decline in cases, we are back on a rise with 1,046 cases detected on this Tuesday, and with domestic infections standing at above 1,000 as well, as imported cases have dropped to the teens. And with that, Korea has a total of 58,725 infections and the death toll at 859. 40 fatalities were reported in the span of 24 hours. That is a record high for a daily death toll. And while we do have 429 less people in quarantine right now, we have 330 people who are currently in severe or critical condition, and that is a record high as well. Now, the average daily caseload stands at slightly above 1,000 throughout the week, and also we have a jump by more than 200 cases compared to yesterday. Meanwhile, the government revised Monday's figure to 807 from the earlier 808.
Right now, so I hear a cluster infection at a detention center accounts for over 200 cases today.
Right, Sunny. The Dongbu Detention Center in eastern Seoul has become one of the largest group infections, as 233 new cases were confirmed as of Tuesday, raising the total from this cluster to 757. So far, over 7,800 COVID-19 tests were conducted on prisoners as well as staff since the first outbreak in late November, and the latest mass testing was conducted on Sunday on around 1,700 inmates. And speaking of mass testing, the government decided to extend tests at temporary screening centers for 2 more weeks, so past January 3rd, which was their initial plan. Now, and they are also encouraging those to be conducted not only in the metropolitan region here, but also elsewhere if regional governments believe it's necessary, and it is necessary in many parts, as we again see all 17 provinces and major cities seeing new infections. And here, the capital, Seoul, 522. That is the second highest number for a daily caseload. And out of 16 imported cases this Tuesday, 10 were foreigners, including 3 from the US and 3 from India, which are countries that now have 19.78 million and 10.2 million infections. And also the UK and South Africa over there are dealing with resurgences due to the COVID-19 variant, with South Africa having surpassed Peru in the past day. If we take a closer look here, over 7,000 infections and 41,000 infections reported in a day in the UK, and over 207,000 infections in the US. And with that, the global tally now stands at 81.6 million. Those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Right, back on the local front now, a more aggressive stance has been adopted by authorities here in efforts to secure vaccines amid concerns about potential delays in public inoculation. I have our Kim Dami here in the studio with details on that. Welcome, Dami.
Good afternoon, Sunny.
So what's the latest on the government's vaccine procurement plan, Dami?
So Moderna will be providing 40 million doses to Korea, which is enough for 20 million people. South Korean President Moon Jae-in held a video call with Moderna CEO on Monday evening Korea time. That figure is double what Korea was initially planning to buy, and distribution will also begin earlier than planned. The top office said the country will finalize a contract with Moderna before the end of the year, so in the next few days. South Korean government also plans to secure 10 million vaccines from the COVAX facility in the first quarter of 2020. The country has also signed separate vaccine deals with Astrazeneca and Pfizer. So if everything goes well as planned, vaccines from COVAX and AstraZeneca will be available for distribution starting in the first quarter of next year, and those from Janssen and Pfizer in the second and third quarter, respectively.
Right. Meanwhile, Tami, I understand President Moon Jae-in has also sought to reassure the public about vaccines.
Right. President Moon said on Monday that Korea will start its vaccination campaign next February, and preparations are going smoothly despite concerns over a lack of supplies and displays in the vaccination campaign.
정부는 내년 2월부터 의료진, 노인 요양시설 등의 집단 수용자와 종사자 등 우선순위 대상자부터 접종을 시작할 수 있을 것으로 예상하고 있습니다.
As some vaccines like Pfizer's need to be stored at low temperatures, the government is also looking to operate up to 250 separate vaccination centers equipped with cold chain systems. Health authorities say negotiations for more vaccine doses are underway in case of an emergency, citing threats such as the latest global resurgence and possible disruptions in the vaccine supply chain.
The vaccines for 46 million people, which the government has currently purchased or is planning to buy, accounts for 88% of the population. And taking into consideration those who are eligible for the vaccines, it is over 100%. So we consider it to be enough to achieve herd immunity.
The government also stressed that the transparency is key and said it will unveil details on the vaccination plan in January next year.
Now, Tami, it's been 2 weeks since the U.S. launched its vaccination campaign, and I understand U.S. service members stationed here in the country are also poised to receive their shots.
Right, so U.S. Forces Korea has started administering COVID-19 vaccines to medical personnel on Tuesday. The USFA official said the inoculation starts at U.S. bases in Osan, Gunsan, and Pyeongtaek today, and Korean service members attached to the U.S. Army, better known as Katusas, could also be eligible for the inoculation. Seoul's defense minister said Monday that the USFK made an official request to hold talks over this matter.
Right. Now, before you go, Tami, what is the latest with regard to the new strain of the coronavirus that was also detected here in Korea recently?
So health authorities say 3 passengers are all family members who flew in from London about a week ago. And on top of that, the authorities are closely monitoring the family of a man in his 80s who came back from the UK on December 13th and tested positive for COVID-19 postmortem. 3 of his family members also tested positive, which prompted the government to look into whether they contracted the new variant. To prevent the further spread of the variant, health authorities have imposed new travel restrictions on the UK, including an extension of its flight ban from the UK for 1 more week until January 7th.
Those coming in from the UK and Republic of South Africa, including layovers, will also be obligated to submit a PCR negative confirmation. Korean nationals are also included on the list so that all people entering the country will have to submit it.
With the exception of state, diplomatic, and humanitarian missions, new visas will not be issued for those coming from the UK and South Africa. And with more countries reporting cases of the new variant, health authorities have decided to conduct further tests on all arrivals before they are discharged from quarantine and check whether they have the variant if they test positive. And an expert says the variant could have a major impact on the future course of the outbreak.
Based on the data so far, it is believed the variant is 70% more infectious. And based on the mathematical modeling, it is 56% more infectious. Even if it isn't more fatal, if it is more transmittable, some more new cases might come out.
And the expert added that health authorities should closely monitor the situation in either countries, whether the new variant is being reported.
I see. All right, Tami, thank you for that coverage. Hope to see you again soon.
My pleasure.
Right, up next, we are poised to join the regular afternoon briefing on COVID-19 here in Korea. Now, for this Tuesday, that is. And while we wait for that to commence, here are a few reminders about some of the prevention measures that are in effect nationwide until the 3rd of January next year. Social gatherings of 5 or more people are banned in the metropolitan region, while they are strongly discouraged in the rest of the country. Restaurants nationwide, meanwhile, cannot accommodate groups of 5 or more diners. The exception to this regulation includes those who live together as registered in their local documents, meaning a family of 5 who are registered under the same residential address can dine together. Also, an exception to the restriction on gatherings is that related to business as well as weddings and funerals, where the cap on attendance stands at 49 or fewer, but 29 for funerals here in capital Seoul. Also, universities face a limit with regard to testings for new applicants, with 49 or fewer allowed at any one venue. All ski resorts have been closed, as have all tourist destinations nationwide. The closure comes in light of efforts to discourage the gatherings of large crowds. The briefing is about to start. We'll come back to you afterwards.
본부장의 설명이 있겠습니다.
Let us now begin a regular briefing on the COVID-19 situation here in South Korea for December 29th. As of today midnight, we have 1,030 new local infections and 16 new imported cases. The total caseload now stands at 58,725. And among them in the metropolitan areas, temporary screening centers, we have also tested 40,703 cases. And also it includes these people, 119 from out of the 48,000 tests, that is. And also yesterday day alone, we had about 108,000 tests conducted on a daily basis. And moreover, we have 1,435 more people being discharged, while 17,163 people remain in quarantine. We have 330 people with critical conditions, and unfortunately, we had 40 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as of today midnight, we are going to go over our major updates on domestic cases by the cluster infections. And also starting from the correctional facility in Seoul Songpa-gu district, we have confirmed 233 more cases. In total, we have 762 cases being confirmed to date. And next, among the religious centers, in relation to a religious center in the Bupyeong city of Incheon, we also identified 19 additional cases. And in Chuncheon, we had identified 8 additional cases. And in Cheongju, in relation to a pastor's meeting, we have confirmed 14 confirmed cases. And also in Cheongju city, in Chungcheongbuk-do province, in relation to a religious center, we have 12 additional cases being confirmed. And also in Donggu of Daegu city, we have 13 additional cases being confirmed. And also after 24th of December, the total number stands at 64. And in Gumi of Gyeongsangbuk-do province, we have 10 additional cases stemming from a religious center, and a total of 82 people have been confirmed to date. And next, as for hospitals and welfare facilities, first we have the nursing hospital and nursing home in Kurogu district. And we have a total of 175 people testing positive there. And also in Bucheon city, in relation to a hospital, we have 11 additional cases. And in Seoul's Songpa-gu district, in relation to a disabled welfare facility, we have a total of 60 people testing positive there. And in Gwangju city, in relation to a nursing hospital in Bukgu district, we also identified 8 additional cases, and a total of 59 people have been confirmed to date. And next, as for business operations in Gyeonggi-do province, Incheon city, in relation to a logistics center, we have a total of 21 people being confirmed to date. And we would like to go over briefly the trends of the imported cases of COVID-19. We are seeing global continued outbreak, and as of the 28th of December, according to the WHO official, we are at the very nearing 80 million thousand in terms of the total tally. And we also have seen that at least 1% of the global population has been infected. And as for major countries who are hit hard by the COVID-19, we have over 18 million cases of COVID-19 in the United States, and in Also, we have over 10 million in India, and also more than 2.5 million in the UK as well. And together with these international outbreaks, the quarantine authorities are also keeping a close eye on the confirmed cases, especially the 3 people who have tested positive for COVID-19 and also have detected the new variant of the COVID-19 strain and who have also flown in the UK. And also we have identified confirmed case contacts of 17 people and who are on the same flight. And we also have tested negative while we still have the incubation period, and we are going to monitor their conditions while on self-quarantine. And as for the new variant of the COVID-19, in order to stem the virus from coming into Korea, we will be expanding the foreign entrants to get tested before their discharge of the self-quarantine measures. And we will also comply and have compulsory PCR negative documents to be submitted for all of the people who are flying in from the UK and South Africa. And as for the confirmed cases, we will be conducting a genetic sequence testing so that we can verify whether these people have been contracted with the new variant of the virus strain. And next, we have some updates on our R&D for therapeutics and vaccines. As for remdesivir, throughout 99 hospitals, we have administered the drug to over 2,500 people, and we are also conducting the clinical trials for the blood plasma treatment, and we have also conducted the blood plasma treatment to about 53 patients here in South Korea. And as for the antibody testing clinical trial, we are analyzing the second trial of these clinical trial. And based on this analysis, we will be commencing the third trial very soon. And as for these areas, we will provide detailed information by the Ministry of Food and Drug Safety. And as for the antibody treatment, aside from the clinical trial at the sites on field, we are also having checking the intentions of the doctors as well as the patient. And we also have approval of 2 cases of injection of these therapeutics and to the patients, and one was carried out in Asan and also another at Inje Hospital. And also we would like to note that the COVID-19 DNA vaccine that is under development here in South Korea, we will be supporting and providing support for the immunity testing, and we will see whether they have the neutral antibody and also the T genetic as well, and we will be providing the support going forward. And also as for these treatment and vaccine development, the most crucial aspect is having an enough number of volunteers and of the participants, and we will be providing more detailed measures going forward. And as for the hospitals and medical doctors and medical staff members, we ask for your continued participation going forward. And lately, we are seeing cluster infections, and through the past weeks, we have seen a rise in cluster infections, especially stemming from religious centers, as well as nursing hospitals and office spaces. And the religious facilities had the most highest frequency of these cluster infections. So once again, we highlight that all of the meetings shall be carried out non-face-to-face means, and also all gatherings should be banned, especially group meals should be banned as well. And we ask for your particular precautions as well. And within the business operations, we ask you to wear face masks and also have a ventilation and also meet non-face-to-face means and cancel any gatherings. And also it is very important to note that if anyone has symptoms, this person needs to be exempted from work and get tested as soon as possible. In relation to this, we have the safety e-report run by the Safety Ministry, and And there are also reports that there are indoor gyms as well as entertainment facilities that have closed the doors. However, they have allowed their members to come into the facility and utilize these facilities. And as for the religious centers, we also have seen many cases where there were breaches of quarantine measures by having physical gatherings and services. And the quarantine authorities will also like to once again highlight the following three aspects for the public. First and foremost, we ask you to cancel all of your private gatherings and stay home safely. And also, as we have mentioned, all of the religious gatherings and all of these meetings should be carried out non-face-to-face means. And regardless of where you are, whether you are indoors or even outdoors, when you cannot keep 2 meters of healthy distance, you need to wear face masks at all times. Moreover, you should also avoid making environments where you cannot wear face masks, including consumption of food and beverages as well. And third, if you have any symptoms like fever or respiratory symptoms, you should get tested as soon as possible by visiting nearby health clinic as well as the temporary testing sites. And last but not least, we would also like to ask the health clinics, if you see any inpatients with respiratory symptoms, please give them a document so that they could be tested, and we need to also guide these people to get tested as soon as possible. So be suspicious of COVID-19 so that with this document, these people could also get tested as soon as possible without any further procedures. Last but not least, we would like to note that in Korea, we are seeing an upward trend of the daily tally, and it's once again in its 4-digit number. And today we had 40 additional fatalities, which is the highest daily death toll since the first outbreak here in South Korea. And especially in December, we have a large number of death toll as well. And as the outbreak is extended and is continued, these infections also lead to higher risks and fatalities among senior citizens who are housed in nursing hospitals. And as a member of the quarantine authorities, I would like to extend my deepest apology for these trends of the outbreak. And also globally, we are seeing continued outbreak, and we are seeing a new record high daily cases on a daily basis. And although the situation here in South Korea is relatively better off than other countries, however, we need to also ask for your continued participation, and we need to also overturn the situation as soon as possible. And this means that we need to focus on the containment of the virus right now. And we are seeing many negative aspects. First, we have high ratio of positivity rate and also high ratio of these confirmed cases under investigation. And moreover, we had the variant of COVID-19 stemming from the UK and South Africa, which could lead another major global outbreak. So it is becoming more challenging for us to combat COVID-19. On the other hand, there are also positive factors. First of all, there was the proactive efforts by the medical circles, and we also have a stable and robust medical capacity. And thanks to the continued research and development of our researchers, we are nearing an end and a major success of the development of therapeutics and vaccines. And we are also seeing a decline of daily cases, and especially among business operations, and also the reproductive rate is also on a decline. And this all verifies that we are seeing the effects of the social distancing measures, and these all are thanks to the cooperation and participation by the public. And we are also nearing cold winter, and as we also have winter holiday and vacation for many students, we will be intensifying our quarantine measures with testing and tracing measures. And starting next February, we will have the vaccination program here in South Korea. And even before that, we will will have the development of the domestically grown therapeutics. And if we have all these virtuous cycles, we believe that the situation here in South Korea will be better. And we believe that our COVID-19 outbreak will be able to be turned around, and we will also exert our full efforts to this end. Looking back on the year of 2020, whenever I stood here for the COVID-19 briefing, I was very much upset by the daily fatalities, and we are also exerting our full efforts to continue our quarantine efforts, and one of our major aim is to decrease the number of fatalities. And I once again would like to extend my deepest words of comfort to the families of the bereaved, and also we would also make sure that we exert our full efforts to contain the virus going forward. Thank you very much.
이어서 식약처에서 코로나19 치료제 관련된
Right, that was Kwon Jin-wook with Tuesday's afternoon briefing. So what did he have to say?
Well, Kwon cited the global situation a number of times today, which also led to the new COVID-19 variant making its way to Korea from the UK recently. And he had some updates on the epidemiological investigation regarding that case. It looks like there were 17 people that made contact with the people that were on board, and that includes 12 staff and 5 passengers. It looks like so far all of those tested negative, although we have to wait for the incubation period to be over.
There is a briefing right now about the treatment efforts so far. Let's take a look at it then.
And going forward, we will have the approvals, and we would like to provide you some details. As for the approval, we have some outlines, and we have received these Celltrion's new drug, and this is a genetically new composite therapeutics for antibody, and these major ingredient is also has been given by the international organizations, and it is a neutralizing body for COVID-19. It is about selecting these genetics and also having a mass production and also injecting this genetics too, so that we can nurture and culture these genetics going forward, and therefore from the blood of the people who have been recovered by COVID-19, we will be using these neutral antibodies, and we will able to produce more antibodies going forward. And as for remdesivir, we also have seen that this also can deter the replication of the COVID-19. However, this new drug can also have effect in treating the patient by being injected to the blood, so that we can prevent the virus from being injected into the blood. And also people with light to severe symptoms could be administered with the drug. And as for the dosages, it is also given by IV for about 90 minutes, and they are also varies for those with light to severe symptoms. And as for the procedures of the research development, here are as follows. And starting from February, from the first development until the approval process, we have been carrying out clear and detailed negotiations with the company, and we have decreased the clinical trial to about 10 months. And we are also making sure that the second clinical trial is carried out very effectively, and we have suggested the number of the participants, and we have been carrying out these trials as well. And Celltrion has been received the approvals for both second and third trials, and also the third trial will be carried out regardless of this second approval, and it will be carried out as planned. And as mentioned, they will be treated, and we have carried out about testings for about 300 people with light symptoms, and we checked whether they have fever and fatigue, and also a headache as well. And we have seen that there has been a major reduction of these recovery periods. And also we looked into the speeding up of these the period from the COVID-19 confirmation to recovery. And in the second trial, we also carried out the 720 participants with severe symptoms, and we checked if they had the fewer symptoms. So these will be carried out going forward. And as for the procedures of these approval, they were carried out just like any other drugs. And with together with Celltrion, we reviewed all of the documents provided by the drug maker, and we have been submitting these to the health authorities. And they will be overviewed, and they have been overviewed by the special officials, and also they have been reviewed by the experts and professionals, and they looked at the clinical and non-clinical areas, and they will be going through detailed review. And after these rounds of review, we will be looking at the feasibility, and we will also conduct a consultation session with our pharmaceutical association going forward. And as for the details of the materials, here are as follows. And under the approval, we are seeing the non-clinical trial data, clinical trial data, the quality, and also the manufacturing quality.
Right, that was the latest with regard to efforts on the therapeutics front here in the country. And we have just learned that Celltrion has submitted its treatment for approval. We'll have details on that later on in our studio session.
The world's first known case of COVID-19 was confirmed in China a year ago, and the novel coronavirus soon invaded Korean soil just a month later. Korean biotech firms sprung to action and developed new test kits to quickly identify COVID-19 positive cases. RT-PCR tests, which amplify the genetic material of the virus, are around 97% accurate and have since become an international standard. So how were these test kits developed so quickly?
기존에 신종플루나 메르스나 지카 바이러스 등과 같은 많은 감염 미생물, 감염균에 대해서 검출해왔던, 설계해왔던 기술을 가지고 있었고요. 한국에서 그런 감염증을 겪으면서 의료진이라든지 진단키트 개발회사라든지 아니면 학회라든지 아니면 지금 질병관리본부나 식약처와 같은 많은 기관들이 이미 경험을 통해서 노하우들이 축적되어 있었기 때문에 그것들이 가능하지 않았나.
Korea also adopted a unique approach to carry out mass testing, becoming the world's first country to set up drive-through and walk-in screening centers. Effective treatment has also been a key component of Korea's COVID-19 strategy, with patients experiencing mild symptoms being given supportive care, while a mix of existing and experimental drugs are administered to those who are critically ill.
바이러스가 증식하면서 이제 손상을 입기도 하고, 또 바이러스를 대응하기 위해서 우리 몸에 면역 세포들이 모여들면서 그 염증 반응에 의해서 이제 우리 몸이 손상을 입기도 합니다. 그래서 이 치료제도 바이러스의 증식을 억제하는 렘데시비르 같은 이제 항바이러스제 또는 지금 개발되고 있는 혈장 치료제, 항체 치료제가 있을 수 있을 것 같고요. 우리 몸에 이제 염증 반응을 억제하는 그런 약물로는 이제 덱사메타존 같은 스테로이드 제제가 이제 주로 사용이 되고 있습니다.
The Korean government is investing heavily into the biohealth sector to support the development of new drugs and vaccines. This has helped Korean drug makers achieve remarkable progress in a short period of time, with 29 treatments being approved for clinical trials and several being cleared for emergency use. Thanks to new advancements, messenger RNA technology has been used in vaccines for the very first time, helping to inoculate millions of people in the US and Europe.
The good thing about the mRNA is that the manufacturing can be faster, more scalable to high quantities, And you can use the same facility for different vaccines. If they're made of RNA, then the process is the same. Different vaccines made with just a different sequence of nucleotides in the RNA. Whereas traditionally, for different vaccines, you needed a different factory for each one and a different process of manufacture for each one. This time with RNA, as I say, you can use the same manufacturing process for multiple vaccines.
Korea is working to secure vaccines from global suppliers and develop homegrown vaccines at the same time.
국산 백신 개발에 대한 지원도 소홀히 하지 않고 있습니다. 코로나의 장기화에 대비하여 백신 주권을 확립하는 차원에서도 꼭 필요한 일입니다.
Human ingenuity has so far proven formidable in our fight against the pandemic. But what tools and technology do we have at our disposal to counter the evolving threat of COVID-19?
In today's session, we revisit efforts to better protect the public amid the pandemic through vaccines and treatments. I have Professor Son Ho-jun from Johns Hopkins University. Welcome to the program, Professor Son.
Thanks, Sunny.
And I also have Dr. Kim Seung-taek from Institute Pasteur. Good to see you again, Dr. Kim.
Good afternoon.
Meanwhile, joining the session virtually is Professor Bang Ji-hoon from the University of Michigan. Pleasure to have you back with us, Professor Bang.
Nice to be back. Thank you.
Right. Professor Son, we've been told time and time again that all viruses mutate. Could you start by explaining to us why they do so and what this reality means for current COVID-19 containment efforts?
Right. The viral mutations occur very frequently because of the nature of the RNA viruses. RNA viruses are very unstable because of its single-stranded nature. And the single-strand RNA viruses especially, they lack in capacity to repair or prove any errors that are arising from the replication process. Now, these mutations don't necessarily have a significant biological meaning, but in the case of the variants that have been observed in the UK and South Africa, have demonstrated that it induces changes in the structure and the form of the binding proteins that binds to the host cells. So, and this, what the experts have indicated and found is that these binding is a lot more effective and faster. So therefore, they confer that the transmissibility of the virus can be enhanced about 50%. But there hasn't been really data yet on epidemiological impact at this point. The other point that's important to note is that clinically, for treatment options or vaccine-induced immunity or disease severity, we haven't found any significant implications of these new variants.
I see. Dr. Kim, what are your thoughts regarding concerns that this new variant that Professor Son has mentioned may render futile current treatment efforts and vaccines?
Well, as you said, we have to actually distinguish between the vaccine and the treatment. But so far, no actually scientific evidence actually exists which suggests that the vaccines or drugs currently in the development or being used are actually do not work against this variant. But we need actually some close investigation. And therefore, especially for the vaccine, I think the way the vaccine works is that the vaccine actually induces sort of just a polyclonal antibody, which is a very many different kinds of antibodies. So if there is any variant, maybe that variant might just affect some single the antibody, but there are other many arrays of different antibodies. So maybe just vaccination should be fine. But in terms of the drug, well, depending on the mechanism of action of the drugs, but for example, like some monoclonal antibody, if that variant, the mutation occurs within very critical point of such an interaction between the antigen and antibody, that might just affect the efficacy of the monoclonal antibody. But obviously, that's sort of just depending on the mechanism of action of each drugs.
I see. Meanwhile, Professor Bang, have authorities over in the US detected the new strain of the virus?
Not here in the United States. We're looking for it, and we think it's likely here. But to my knowledge, there's no confirmed cases of the UK variant viruses here in the United States. We think it's here, but we can't find it. So it's likely a very small amount at this point.
I see. So what is the latest with regard to the COVID-19 situation over in the US then?
It's always been kind of out of control, and it's surging, and many states are, kind of California especially. It's experiencing this amazing surge, and they're running out of hospital beds, and so it's really not a good situation. And then we have Christmas and New Year's, and people are still traveling and seeing family members and friends. So in the 2 to 3 weeks, we're expecting a bigger surge than what we're seeing right now. So we're not in a good situation.
Right. Professor Soon, what are your thoughts on the safety of Pfizer's and Moderna's vaccines amid the cases of side effects thus far, including that of a doctor over in Boston who I understand suffered a severe allergic reaction?
Right. To give you a context, I'd be more concerned about the misinformation about the vaccine safety. But just to keep to the point, I think the vaccine safety, the issues that have been raised, especially for all of the vaccines, the side effects that have been so far reported are not as significant as those have been observed in other vaccines, such as the influenza vaccines. So allergic reactions are common also, and I think the particular allergic reactions that have been observed definitely severe, and it's important to monitor, but the CDC and the authorities are monitoring very closely about these and have been recommending that people who have experienced these severe allergic reactions to previous vaccinations should be cautious and remain in the vaccination areas for about 15 to 20 minutes for post-vaccination observation.
I see. Professor Pang, in response to criticism over its initial passive approach to vaccine procurement, authorities here in Korea have underscored the importance of safety and pointed out that countries that have launched vaccine campaigns are those that are in dire need. Do you share this sentiment?
Yes, because, when we were making all these decisions, things were really bad. And so it was not a difficult decision for us to implement a very aggressive mass vaccination campaign. Until recently, Korea was one of the countries where COVID-19 was under control. And I would argue it's not out of control right now, even right now in South Korea. So it's all about risk benefit. This is not an officially approved vaccine. The data that we have seems good, but it's not final, and we're still monitoring these patients. And so it's all about risk benefit. Here in the United States, benefit of vaccine far outweighs the risk. In South Korea, it might be different. So it's not an easy answer, I guess, but I kind of agree. Yeah.
I see. Dr. Kim, please share with us the progress on the treatment front by Korean pharmaceutical companies. Earlier on during the briefing, we heard about Celltrion having submitted for approval its treatment. Please give us the latest there.
Well, actually, just Korean R&D for this COVID-19 drug development is actually very similar to some foreign countries, where we are actually approaching 3 different ways. The one is monoclonal antibody, which is mostly the Celltrion at the moment, and then convalescent plasma, and then GC Green Cross, and then the others are drug repositioning. And then all those drugs are actually on the different phases of clinical trials, and as was reported by the Korean CDC and then FDA. Mostly it's just phase 2, and then expecting some phase 2 clinical trials. And some of them, we are expecting some results of clinical trials this month and then next month.
I see. Yeah. Meanwhile, Professor Soon, trials are underway over in the UK for an antibody treatment, and this comes less than a month since authorities there began their vaccination campaign. Do you see these combined efforts perhaps as ensuring a quicker path to herd immunity?
So I think it's definitely one way to achieve herd immunity and then curbing the virus transmission in the society. I don't think there's a single solution that can achieve that. We have vaccines. Vaccines are efficacious, but in terms of vaccines, we have to be very concerned about vaccination coverage, and we have concerns about vaccine safety, that a lot of people are concerned in the U.S. and undecided about the vaccination. In terms of the treatment, the convalescent and the monoclonal antibody therapies are very difficult to administer and are very expensive. So generalizing these type of treatments is also very difficult. And one of the things about the antibody therapies is that they are very time sensitive. So you need to have test and treat capacity. And in many countries, even in the US, it's very difficult to achieve that.
Right. And Dr. Kim, keeping what Professor Son has just said in mind, do you believe the therapies being developed here in Korea could address perhaps some of the shortcomings that have been exposed in the first-generation drugs?
Well, I think so. Most of the parties, I think, is very similar to the already developed. But for some monoclonal antibodies, because there is some issue of how to administer such antibodies to the patient. Mostly we do use some IV injection, but that delivery to their lung is not really just effective. So there's some people are just considering for example, like a nebulization, which is administer the antibody directly to their lung. So that might be some of the alternative way, but mostly very similar to the approaches taken by other foreign countries as well.
I see. Professor Pang, in your opinion, what are your thoughts on Korea's advances in the biotechnology sector amid the pandemic? A very short response, if possible, Professor Pang.
Well, I mean, Korea is like a model country for its public health measures. That's, I think, the big thing that Korea has taught us. Good public health measures like contact tracing, mask wearing, social distancing works if done well. In terms of the biotech sector, I mean, it's I don't know too much about it, but the monoclonal antibodies that are being developed, the vaccines that are being developed, they seem promising. So we'll have to see the data, but it is an amazing achievement that Korea has done. So I think it's good.
All right, Professor Pang over in the US, thank you very much for joining us live at this. Dr. Kim, as always, thank you for being with us. And Professor Son, thank you for your insights.
Thank you.
Right, well, having addressed the social and cultural changes amid the pandemic yesterday and efforts to fight it today, tomorrow we'll be back with a look at the economic impact of COVID-19. See you then. Thank you for watching.